Imagine this. Someone coughs in a crowded room. Tiny invisible particles float through the air, and within days, several people in that same room become sick. No touching, no sharing food, just breathing the same air. This is the hidden power of airborne diseases, illnesses that spread silently through the air around us. From tuberculosis to measles, these diseases have shaped human history and continue to affect millions of people every year. So today, we're going to break it all down in simple terms. What airborne diseases are, how they spread, which ones are most common, and most importantly, how you can protect yourself and your family. Let's get started. What are airborne diseases? Airborne diseases are infections that spread through tiny droplets or particles in the air. When an infected person coughs, sneezes, talks, laughs, or even breathes, microscopic particles containing viruses or bacteria can be released into the air. These particles are so small that they can float in the air for minutes or even hours. When another person breathes in that air, the germs can enter their body through the nose, mouth, or lungs, causing infection. What makes airborne diseases especially dangerous is that you don't need direct contact with the infected person. Just being in the same environment, especially a poorly ventilated room, can sometimes be enough. Think about places like crowded buses, classrooms, offices, hospitals, markets, anywhere people gather in enclosed spaces. The science behind airborne transmission. To understand airborne diseases better, we need to look at how the particles behave in the air. There are generally two main types of respiratory particles: large droplets. These are heavier and fall to the ground within a short distance, usually about 1 to 2 meters from the infected person. Aerosols or droplet nuclei. These are much smaller and lighter. They can stay suspended in the air for long periods and travel farther distances. Airborne diseases are mostly spread through these aerosol particles. Imagine dust floating in sunlight through a window. Now imagine that dust carrying viruses or bacteria. That's essentially how airborne transmission works. And because these particles are invisible, people often spread diseases without even realizing it. Common airborne diseases. Several serious illnesses spread through the air. Let's look at some of the most well-known ones. Tuberculosis. Tuberculosis is one of the most dangerous airborne bacterial diseases. It mainly affects the lungs and spreads when an infected person coughs or sneezes. TB is still a major health problem in many parts of the world. Without treatment, it can be life-threatening. However, the good news is that TB is treatable with antibiotics when diagnosed early. Measles. Measles is one of the most contagious diseases known to humans. In fact, a person with measles can infect up to 90% of unvaccinated people around them. The virus spreads easily through coughing and sneezing, and the particles can stay in the air for up to 2 hours after the infected person leaves the room. Symptoms include high fever, cough, runny nose, red eyes, skin rash. Vaccination has dramatically reduced measles worldwide, but outbreaks still occur when vaccination rates drop. Chickenpox. Chickenpox is another airborne viral infection that spreads easily among children. It causes an itchy rash and small fluid-filled blisters on the skin. Although many people recover without complications, it can be serious for adults, pregnant women, and people with weak immune systems. Vaccination has made chickenpox much less common in many countries. Influenza, flu. Seasonal flu spreads mainly through respiratory droplets and aerosols. Every year, influenza infects millions of people worldwide. Symptoms usually include fever, body aches, fatigue, cough, sore throat. While most people recover within a week or two, the flu can be dangerous for elderly individuals, young children, and people with chronic illnesses. COVID-19. One of the most well-known airborne diseases in recent years is COVID-19. The virus spreads mainly through aerosol particles released when infected people breathe, talk, cough, or sneeze. The global pandemic showed just how quickly airborne diseases can spread when people are in close contact. It also taught the world the importance of masks, ventilation, vaccination, public health awareness. Why airborne diseases spread so easily. Airborne diseases spread faster than many other infections for several reasons. First, they are invisible. You cannot see the particles in the air, so people often don't realize they're being exposed. Second, they require little contact. Unlike diseases spread through physical contact or contaminated food, airborne diseases only require breathing the same air. Third, crowded environments increase risk. Places with many people in close proximity allow germs to move quickly from person to person. Fourth, poor ventilation. When fresh air does not circulate properly, virus particles can build up in the air, increasing the risk of infection. This is why outbreaks often happen in schools, hospitals, public transport, workplaces, large gatherings. Symptoms of airborne diseases. Many airborne diseases affect the respiratory system, so the symptoms often look similar. Common signs include persistent cough, fever, difficulty breathing, sore throat, runny or blocked nose, fatigue. Some diseases may also cause skin rashes, chest pain, or weight loss depending on the infection. If symptoms last longer than a few days or become severe, it's important to seek medical care early. Early diagnosis can prevent complications and stop further spread. How to protect yourself. The good news is that there are several simple ways to reduce the risk of airborne diseases. Improve ventilation. Fresh air is one of the most powerful defenses. Opening windows or improving airflow can dilute virus particles in the air and reduce the chance of infection. Wear masks in high-risk areas. Masks help block respiratory particles from entering or leaving the air. They are especially useful in crowded indoor environments like hospitals or public transport. Vaccination. Vaccines are one of the most effective tools in modern medicine. Vaccination protects individuals and also helps create community immunity, reducing the spread of disease. Vaccines exist for several airborne diseases including measles, influenza, COVID-19, chickenpox. Practice respiratory hygiene. Simple habits can make a big difference. Cover your mouth when coughing or sneezing. Wash your hands regularly. Avoid close contact with sick individuals. Stay home when sick. If you are ill, staying home protects others around you. Many airborne diseases spread most easily during the early stages of infection, when people may still be active in public. Why awareness matters. Airborne diseases are not new. For centuries, they have caused outbreaks, pandemics, and millions of deaths. But today, we have something powerful that earlier generations didn't have: scientific knowledge. We understand how these diseases spread. We have vaccines, treatments, and prevention strategies. But knowledge only works if people understand it and act on it. By learning about airborne diseases, we can make smarter choices to protect ourselves and our communities. Finally, airborne diseases spread through tiny invisible particles in the air, but their impact on human health is enormous. From tuberculosis to influenza and COVID-19, these infections remind us how connected we all are. The air we share can carry illness, but it can also carry awareness, responsibility, and prevention. And the truth is simple: a few smart habits, good ventilation, vaccination, masks in risky settings, and basic hygiene can save lives. If you found this video helpful, make sure to like the video and subscribe to Balanced Motion Health for more simple, science-based health education. And share this video with friends and family, because understanding airborne diseases could help protect someone you care about. Stay healthy, stay informed, and I'll see you in the next video.